Hey guys, Dr. Justin Marcajon here. Today we're going to be talking about testosterone in women. Is testosterone in women important? We're going to dive into that today. Before we do, please smash the like button. Make sure you sub and hit the bell so you get notifications. Love to see your comments down below. So testosterone is one of these hormones in women that is a forgotten hormone. People don't know, but testosterone, it's actually the most predominant hormone in the female body by like 3 to 4x. People don't know this, right? They think, oh, it's got to be estrogen, it's got to be progesterone. It's actually not true. You're going to see testosterone on average, it's about 3 to 5 times, 3-ish higher in most women. You think it's testosterone is a male hormone, right? It is, right? Men have about 10 times more testosterone than women do, but testosterone is still the predominant hormone in women. When you test testosterone on the actual blood test, I'll pull one up here in a minute. You're going to see testosterone is typically tested in nanograms, and you'll see some of the other hormones tested in picograms. So nanogram is essentially decimal place and then 9 zeros or 9 places, right? So 0, 0, 0, 0, 0, 0, 0, 0, 0, and then whatever the number is. So the 9th number is nano. The 12th number will be pico. So when you look at some of the estrogens, you'll see picograms. So estrogen looks like a bigger number. It'll be like 100, 150, but it's in picograms. So you got to move the decimal place to the 3 places to the left, so it ends up being a 0.0, 0.15, whatever. So it's a number that's much, much smaller. In progesterone, you'll typically see it, in the luteal phase, like around 15. But a good testosterone in the luteal phase will be twice that, right? So typically in progesterone, you may see 2, 3, 4 during the month outside of luteal phase. So testosterone, you'll see, is exponentially higher. Pull up a sample lab test so you can see. So here's your estradiol right here. Picograms per ml. To convert that into nanograms, you move it to the right or to the left 3 times, so it's 0.169. You go look at progesterone, right? That's nanograms per ml. And then you have the same thing, testosterone, right? So it's about twice what testosterone is. And again, remember, this is going to be the highest place in a woman's cycle because this was taken in a patient during the luteal phase around day 20. So this is going to be the highest that progesterone typically will be. Outside of that, it'll be less than 1 in the follicular phase, and it can even be much lower during ovulation as well. So luteal phase is the highest, and then you're going to see follicular phase the lowest, and you can see testosterone is much higher than that on average. So pretty cool. Most people don't know that. Now, testosterone, what its importance are. I mean, why is it important? What are the key importances of it? I would say first thing, libido. It's going to play a big role with libido in women. One thing you'll see with women is testosterone a lot of times with hormonal issues can go too high, and usually there's a PCOS component, polycystic ovarian syndrome component. And usually as women, they're eating too much carbs. There's a lot of insulin resistance driving it. The enzyme that converts estrogen to testosterone is a enzyme called the 1720 lyase enzyme. I'll pull up a test here that shows that for you guys so you can see it. But that enzyme is important for converting estrogen to testosterone. And one of the big things that drives that is going to be insulin. And so I'll try to find an image here for you guys live on the spot so you can see what that's looking like here. But that's a big component with a lot of insulin resistance problems, right? So you can see it right here. I'll pull this up here. Yeah, I'll pull that up in a second for you guys so you can see it and make sense of it for you. But that's a big deal, right? Because a lot of women, too much carbohydrate, too much processed food, maybe too much carbs in general. The more processed you get, the more insulin surges you get. The more insulin you surge, you create this reactive hypoglycemic roller coaster that most women sit on all day long, right? Too much carbohydrate, blood sugar goes up. Insulin surges up, brings it back down. Cortisol and adrenaline pick it back up. So it's this blood sugar up, insulin down. Cortisol, adrenaline brings it back up. More cravings when it's low, more carbs, more sugar, more insulin, and this blood sugar goes up and down throughout the entire day. This is it's a big deal, right? Because if you're living your life on this blood sugar roller coaster, guess what's happening to progesterone every time your blood sugar's up and down? Well, progesterone can actually pinch hit for cortisol. And so when blood sugar drops, cortisol and adrenaline help pick it back up. So then you're constantly utilizing and converting your progesterone to cortisol to lift that blood sugar back up. That's a problem because that further creates this progesterone-estrogen imbalance. You start creating more estrogen dominance by dropping out your progesterone. That's a big deal. And so when we look at, here we go here. I'll pull that here so you guys can see that. That'll be helpful for you. So a couple things here out of the gate for you guys. All right, cool. So a couple things you can see here. So this 1720 lyase enzyme, you'll see it start to convert some of the cortisol. some of the hormones downstream to DHEA, and you also see it convert over here to androstenedione right here, and then that brings it into testosterone. So you can see this enzyme 1720 lyase converts more to DHEA, which is a precursor, and then more to androstenedione, which is in just one step above here for testosterone. So that's important. People don't realize that. And so when you're doing that, a couple things happen. One, you're going to start to increase prolactin if you're a female. That starts to dysregulate the cycle. Two, you're going to increase, that's going to throw off the cycle. And two, it's going to also start to disrupt dopamine, right? Because the more stressed you are, the more inflamed you are, dopamine starts to go down because you're converting dopamine to adrenaline to deal with all the stress, deal with the inflammation. And dopamine, it's a gas pedal inhibitor on prolactin as well. So progesterone hits the hits the brake on prolactin. So if you have good levels of progesterone, you have the brake. Prolactin can't go up. You start to pull your foot off of progesterone starts to go lower, prolactin goes up. Same thing. If you have dopamine, right, you're making good dopamine, you're eating good protein, you're managing your stress well. Now you're starting to become stressed. Now you're converting dopamine downstream to adrenaline. Guess what happens to prolactin? Dopamine's also a brake on prolactin. Pull your foot off the brake pedal, prolactin starts to go up. So now you start to have cycle dysregulation. Now you have that 1720 lyase enzyme that's increasing, and that's causing more of your female hormones to convert to your androgens, and then that starts to grow more facial hair growth, right? More on the jawline. You're going to start to see more acne because insulin and androgens also increase sebum production on the skin. Sebum then feeds the Cutibacterium acnes. That's the name of the bacteria, Cutibacterium. A little funny name there, but it feeds it, and then you start getting cysts and inflammation because of your skin. So that's a big thing out of the gate. Now, testosterone. Important for muscle mass, important for recovery, very important in men in the frontal cortex for motivation, women as well. If you go read Dr. Jonathan Gray's book, Men Are From Mars, Women Are From Venus, he talks about how men and women deal with stress, that the high levels of cortisol buffer the stress response in men. So I imagine it works similarly if you have good levels of testosterone in women, healthy, not like male levels, but levels that are going to be healthy. That is going to allow you to have a better buffer for stress. A lot of motivation kind of centers in the frontal cortex have testosterone receptors. So motivation, really, really important with testosterone. I would say recovery as well. A couple things. Testosterone at a healthy level, like 75. Let me look here. I'll give you the exact level. But once you start getting testosterone in the upper, let me pull this one up here so you guys can see it again. I'll pull that up there for you guys. So we start getting testosterone in the level of, so you can see here, a lot of times on the bioidentical side, they'll start to put testosterone. So the high end of the range is 45. If they're doing pellets or even, let's say, gels, they'll start to increase testosterone 75, 80, 100. You got to be careful. I don't like to do it too much above the actual reference range. But once you get into the top part of the reference range, there's actually beneficial effects on reducing breast cancer. So testosterone does have some good benefits. Cancer reduction in breast cancer starts around 100. Typically, you don't ever want to go 250. The problem is I see a lot of guys at 250, so putting a female at a low level of a guy, I got a problem. I like to keep hormones within the natural functional range. Just keep it at the top. And I also like to look at the free fraction. This patient's kind of mid-range. They could be a little bit higher. But when we test testosterone, I like to do LCMS, which is a liquid chromatography mass spectrometry. The typical enzymatic ones, the MS version. This is an enzyme-based one. It's okay. If you're giving bioidenticals, it's good to run the LCMS, a little bit more accurate. But you can see here, in that the top part of the reference range, 40, 50, a lot of the conventional people will get into 80, 90 because of the breast cancer reduction risk. Again, I saw a patient today on a pellet, and she's sitting around 500 to 750, and 750 is higher than 80 to 90% of guys I see. And this person's seeing a kind of more natural, functional, or natural kind of MD person. But it's very easy for MDs to even use hormones at a level that I consider to be too high, way outside of the physiological reference range for a woman, even at a good range for a guy. And they're doing these things because they're using hormones to make people feel good. They're using hormones like supplements. Hormones should be used at reasonable low levels within the physiological reference range. And if someone's younger, you want to get their body and their glandular system to make more hormones on their own. It makes sense if someone's menopausal, Guys in his 50s, you get their diet right, their exercise right, their sleep right, they're eating good, they're breaking their protein down, using some herbs, and you're still in that bottom half of the reference range. Okay, fine. Let's come in with lower dose levels and figure out the best way to get that up naturally. The problem with a lot of people using testosterone therapies, my opinion, they're just getting lazy. They're doing pellets or they're doing injections once a week. The problem with those things, if you measure someone every week, their levels are going to start like this. We'll start high on a pellet, and then every month they go down literally 10%. I could pull up studies on this. You'll see month 1, month 2, like a 10% drop each month. The problem with that, it's convenient if you're the doctor. Put a pellet in someone's butt, it's done, come back in 4 months. But from a day in, day out standpoint, I want my levels on day 1 to be the same as day 120. And you have a hard time doing that when it's a pellet. So if you're a female, maybe doing a cream is a good idea, or a troche is a good idea. Or if you're going to do an injection, I like to do the smallest amount I possibly can. With my guys, I'll try to have them inject every other day if they're going to do testosterone, or there's other products out there like Testo, which is a sinus spray where you can kind of mimic the natural production. So the average guy is going to make about 6 to 10 milligrams of testosterone a day. You can come in there and do 2 milligrams 3 times a day and just kind of mimic that naturally and never give a large enough bolus to disrupt LH and FSH. So guys that do the very small microdose, they actually have no testicular atrophy. They have no repression of their LH or FSH. It doesn't drop due to the feedback loop being disrupted. And women will make like 0.5 milligram to 2 to 3 milligrams, so much less. And so I much rather come in there and microdose, whether it's with a gel or something else, injection or a troche or a spray. So it's always better to come in there and actually fill in the gap with the smallest amount of hormone possible. Let the body do the rest. Like, it's silly to come in there with hormones when you're not getting someone to sleep, you're not getting some movement, some resistance training, you're not getting good protein, digestion, and synthesis. So you got to get all these things dialed in first. Now, that being said, the adrenals play a big role. As a woman gets older and they start going more perimenopausal to menopausal, they're not going to get as much hormonal output through their ovaries because the follicle production is now gone, right? They're kind of premature, or follicle failure, if you will, because now they're in menopause, which the follicles, essentially you have your ovary, you have FSH starts the month, that's your follicle stimulating hormone, that causes the follicle in the ovary to mature and turn into an egg. That egg pops out, increase as the egg pops up, estradiol increases, LH increases, LH increases, progesterone increases. So you have this rise in FSH, followed by a rise in estradiol, followed by a rise in LH, and then LH causes progesterone to come up. So you have this estrogen increase, followed by a progesterone increase, and kind of where that it meets is where ovulation happens. Estrogen kind of peters off throughout the month, and progesterone stays high and then drops. And that's your typical luteal phase, the last half of the cycle. So you have your first half predominated by estrogen, and you have your last half predominated by progesterone. And so really important. And testosterone, guess when testosterone tends to go up the most? Around ovulation. Why? Well, because that increases libido, and that's Mother Nature's way of saying, hey, let's go make some love and make babies, right? That's essentially how that works. And so you can make sure your hormones are dialed in by supporting good, healthy DHEA, because DHEA is made by the adrenals, and it's going to be significantly produced by the ovaries when you're cycling. But when you're not cycling, guess what? You're going to have to rely more on the adrenal glands. So as a woman gets older and gets more perimenopausal, menopausal, you're going to rely more on that DHEA. Now, if a woman's even younger but stressed, under a chronic stress or chronic inflammation, DHEA is going to be a very important kind of building block to help fill in the gaps of the hormones that are missing. So adding in lower doses of DHEA, anywhere between 5 to 15 milligrams, could be helpful. Many doctors use DHEA way too high. Again, my philosophy is coming in with the smallest amount possible. Start low. You can always work your way up. You can always use herbs and things like that to help fill in the gap, like maca or chaste or dong quai. These are things that can be very helpful out of the gates. Also, things like ashwagandha, things that can buffer cortisol, theanine, wonderful things to calm cortisol down, help that good HPA axis. That's the brain feedback loop from the brain to the thyroid to the adrenals to the gonads and ovaries. Hope that helps. So in general, testosterone is important for women. Yes, it is. It's the major predominant hormone in the female body by 2 to 3x, maybe even higher in some women. It's a double-edged sword because too high of testosterone is the number one cause of infertility in women. It's called PCOS. The testosterone, high doses of it will cause follicles to grow, and that can cause prolactin issues. and that can disrupt the cycle and cause fertility problems. The number one drug for treating that, guess what? It's metformin or glucophage, which helps with insulin sensitivity. Get your carbs in check, get your nutrients and your blood sugar stuff in check, get the inflammation down, because inflammation and insulin is what's going to drive PCOS. The hair growth, the muscle mass, which is good in a woman. You don't have as much as a guy. You're still 10x away, so you're never going to get overly jacked unless you're supplementing additional testosterone, and you won't even get the vocal cord hypertrophy, because you're not going to, the deepening, because you have to be testosterone-wise up to 250 and up to have that kind of stuff, right? That's what guys have, but they're 10x higher than the average woman. So hope that makes sense out of the gates. A lot of benefits in mood, memory, buffering, stress resiliency, muscle, and libido. Get your levels looked at. So based on kind of some of the labs that I recommend here, a good level here would be somewhere in the top quarter of the reference range. So 30 to 50 would be good, and somewhere between probably 4.5 to 5. And again, these are levels when you're not on hormones. If you're on hormones, you can always adjust it a little bit. I recommend doing something that you can adjust the dose daily. That gives you the best ability to keep your hormone doses super stable. When you look at some of the data on the pellets, you will see all kinds of hormonal drop. I'll pull up a study for you. I saw this last night when I was researching a little bit. It was quite fascinating. It was exactly what I thought, based on having tested many people over time. So here you go. Here's a good one right here. This is the exact one I saw last night. All right, good. So you can see here, so this is like 1 month, 2 month, 3 month, 4 month, 5 month, right? And then you can see testosterone levels, and you can see, look at, you're going from 750 to 6 to 450. So you can see that general, let's say about 10% drop per month based on month 1, month 2, month 3. So, this is why, and again, I'm not sure the pellet numbers, but what I'm looking at is just month 1, month 2, how that drops. And so I'd rather have that line be relatively straight. That allows you to feel good, better mood, better energy, better focus, better muscle, healthier libido as well. All right, guys, it's Dr. J here. I hope you enjoyed today's video. If you did, please let me know. If you want to dive in, if you need more support on your hormones, either male or female hormones, you have menopause or PMS or any cycling issues or fertility issues, there'll be a link down below if you want to reach out and dive in. Happy to answer your questions or get you in for functional medicine consult support worldwide if you need that. If you enjoyed, put your comments down below. Love to see it. Give me a like and share and bell for notifications. All right, guys, have an awesome day. Take care, y'all.